Wikidonist.com. Truth about tooth.
Most of the people who used to watch our videos or even come to our clinic used to ask, why are aligners so costly? It's just a plastic device, it's like a very thin plastic one, and why is it so costly? So, today's topic is all about why is it costly and what are the benefits out of it, why it can become cheaper, but why is it costly as of now. I am Dr. Thomas Nechipadam from Nechipadam Dental. If you have not seen my videos, please make sure that you watch some of the videos which is there in the past also, and please subscribe and put that bell button on before you go any further. Thank you very much for watching, and if you have a comment or if you understand more, if you want to understand more about aligners or any other dental treatment, please comment. And today's topic is, as I told, the cost of aligners. Cost of aligners has been drastically coming down because there are a lot of competitors in the thing. The first aligners were done by Invisalign, and I still remember it was not affordable for an Indian at all at that point of time because it was all done by US people. It had to have a specific certification, then only even now they will not give Invisalign will not give aligners to a dentist, especially in India. It needs an orthodontist to do the Invisalign, and it needs an Invisalign training to do Invisalign in India. So, now why is it costly? Because even though we see only the clear plastic thing that has to be worn, there is a lot of technology going behind. There is a software which is actually designing the whole thing. The orthodontist has to be paid, that is only one part to it, and then it goes to the company. When in the company, what happens is basically your impressions or your digital impressions, the scan has to go to the company. The company will take it to do this thing, it will analyze the width of the tooth and the positions of the tooth, and then the orthodontist would have told how many millimeters has to be moved back and things like that. That has to be emulated onto the software, and the software decides exactly how much and how it has to be moved, and the orthodontist will correct the whatever changes also, and then it is confirmed. From then there is a 3D model which is already there, and how many millimeters, around 0.26 millimeters is what an aligner will move, only 0.26 millimeters. 0.26 millimeters for your understanding is around 1/4 of a millimeter. You know centimeter and millimeter. Centimeter is 10 millimeters is 1 centimeter, and we are talking about 0.25 millimeters. So, one tray will move only 0.26 millimeters of your tooth. So, we need to have a lot of aligners to move the teeth to your right position. At least we need to have a 3 millimeter movement, then only we will be able to appreciate the movement at all. So, we need to have a lot of aligners, and it is sequential. As I told you in the last videos, it is sequential aligner therapy, and it needs a sequence of at least 5 or 6 or sometimes up to 50 or 100 aligners needs to be used to do the treatment. Now, all these things has to be 3D printed. I told you that the 3D model which is there on the computer will be actually morphed into the final model, which is actually the tooth movement which has been subscribed by the orthodontist. Now, the prescription of the orthodontist has to be exactly matched with the orthodontic movement which is planned by the computer itself. Now, from there to this one, how many aligners has to be there will be decided by the computer, because it will be divided into 0.26 millimeters of movement, and each tooth has to move, and you cannot move all the teeth together. See, like if you have to a 0.26 movement from one tooth and the other tooth also, then you will get 0.5 millimeters, but that is not possible with the aligners at all, because it needs to conserve the anchorage, or it has to, the tooth on the back has to stay there, and then your front tooth has to be moved backwards. So, then only you will get affect all these movements. So, it needs to be planned like that. So, maybe a group of 4 or 5 tooth will move, the rest of the teeth will stand. So, the rest of the teeth will move in a later point of time. All these things are planned and the video will be sent to you before the treatment starts. That is what the orthodontist will do. Once the treatment plan is done, it will be shown to you how the tooth will move, and then the number of aligners will be decided. Once the aligner number has been decided, then it has to be printed. Each cast or each jaw's teeth has to be printed individually. So, that means that there is a lot of cast that has been made, and this has to be sequentially made, and that has to be planned like that, and on top of that cast only we are actually making the aligner trays with the plastic thermoformed plastic stuff. And on top of that, it has to be trimmed properly, and then it has to be sequentially planned, and it will be sent to the orthodontist, and the orthodontist will give you. At the point of orthodontist giving it, if at all there is an attachment, the doctor has to actually put attachments onto your teeth, and that also incurs a cost. With all these things is the cost of the aligner. So, we are actually printing custom, it is all custom made for you, and the print cannot be used for any other patient because it is made according to your face and your mouth, and it is actually custom made for you. Each aligner is custom made for you. So, each aligner will cost you between the number of casts that has been made, or the number of 3D printed models which is being made has to be charged to you. One. Second thing is the material, the thermoformed material which is usually made from different companies abroad, that has to also be charged to you, and there may be laser corrections which has to be made. The 3D printing, there are 3D layering on top of aligners like Invisalign and things like that use other laser guided stuff for correcting even the smaller crevices and things like that. All this technology needs to be paid, and the software company has to be paid separately. So, all these things contribute to the cost of the aligners. So, even though you see a glass clear plastic thing which is actually if you go and buy plastic which is there in the normal shop, so it will just cost somewhere around 50 paise or 25 paise or even maximum 1 rupee, but you might see that only, but it is been custom made for you to affect a tooth movement of around 0.26 millimeters. So, if you have to move the tooth around 10 millimeters all across, so you need to have that many number of aligners, that 10 millimeters divided by 20.26, that is around 40 aligners to move the tooth. So, 40 upper and 40 lower is going to be, you can imagine, around 80 models has to be made, and from that 80 models only we are getting all these aligner therapy. That is why the aligner therapy is costly, and that is why you have to be charged that much, and the doctor also has to get some money. So, with all these things is why aligners are costlier than the braces, because braces are not custom made for you. That is why there are custom made braces for specific, some of the cases we can use custom made braces, but that is also costly or sometimes costlier than the aligner itself. But braces are actually made in bulk, but aligners are made for the patient. So, it is a custom made. It is like going to a designer to make your own suit, and then it will be costlier, or if you just buy it from a normal shop or a ready made shop, it will be cheaper. Like that, braces are custom made, it is not custom made, and aligners are custom made for you. So, that is why the cost of the aligners are much more higher. Please understand, but it is a very aesthetic one, it is much more efficient in moving, it is much more faster in most cases, and it is also very clean treatment, because it enables you to brush and keep the tooth clean. So, aligners, although it is costly, it has its own advantages. That is why aligners are there in the treatment plan. Thank you very much, Dr. Thomas Nichipadam from Nichipadam Dental. Next week I will be coming with another topic. Until then, bye.
Wikidonis.com